This has been on my mind for quite some time. Let's talk about breast cancer surgery with lymph node removal. If you have breast cancer surgery in your future, please take a moment to watch this. Since being diagnosed with breast cancer, I have talked to many women, and I have learned so much. I have found other women that have the same exact cancer and same stage as I am, and their treatment plan is different. Each of our journeys is as unique as you are. It's all going to depend on what your oncologist and surgeon think is the best plan of attack for you. But when it comes to breast cancer surgery, I feel like there needs to be a standard. Excuse me while I step up on my soapbox, but this I feel is important, and I think you guys should all know about it. So if you are going to have breast cancer surgery, it doesn't matter if it's a lumpectomy like I did, or a mastectomy. If they are playing with your lymph nodes, you need to be aware that you could develop lymphedema or cording. And what irritates me is that these surgeons and doctors are not making it standard practice that you automatically get signed up for physical therapy. I've talked to other people. I've seen you guys on TikTok. I've seen you in the breast cancer groups. Some places will automatically get you scheduled for physical therapy, and I think that is genius. You can always cancel it if you don't need it. Then you got my situation. So I had a lumpectomy on June 30th, and they took out 3 lymph nodes. Thankfully, none were positive. Anyways, my lumpectomy site healed beautifully, but I did develop cording. And that is where you will feel like there is a literal cord going from your armpit down your arm. And it started from here to here, and then I could feel it. It started feeling like it was creeping down my arm as the days went by. So when I had my 2-week post-op appointment in mid-July, I mentioned it to them. Keep in mind, my doctor's office didn't send me home with any pamphlets, any papers, any, hey, this is what to look for, here's exercises you can do at home, nothing. I only knew about it because of my fellow breasties. So that's what irritates me. And when I mentioned it to my surgeon, he said, oh, no problem, we can get you scheduled for physical therapy. I'm like, cool, thanks, doc, let's do this. You guys, my surgery was June 30th, and they wouldn't have been able to see me at the physical therapist's office because I needed a specific physical therapy, not just general. My first appointment would have been October 4th. June 30th to October 4th. I think that is absolutely ridiculous. Thankfully, I was able to alleviate it by myself at home, doing stretches and stuff, thanks to Google, because nobody gave me any information. And on top of that, I'm on leave of absence. I can't imagine having to go to work with that horrible cording feeling. So, the takeaway from this is if you are going to have a breast surgery with lymph node involvement, please talk to your doctor about physical therapy. Hopefully they will just schedule you right off the bat, and then you can always cancel if physical therapy is not needed. But I want you to be aware that that is a thing, because nobody told me. I had to figure it out on my own, thanks to my fellow sisters, okay? So there's my PSA for the day. I'm going to step off of my soapbox now, okay? I love you guys. I'll talk to you later. Bye.